everyone, I am Casey Latombo, your student nurse from Double Doctors College, and today I am going to perform the female urinary catheterization. So urinary catheterization is the process in which the catheter is inserted to the bladder to collect or drain the urine. So first thing to do is to check the physician's order for the catheterization. And of course, introduce yourself to the clients and verify the client's identity using two identifiers. Then, establish a good rapport to the clients and of course, provide the clients the opportunity to ask or raise for her, or any concerns. So, ask how the clients and how she would like to call during the assessment. So then, of course, apply the gloves as necessary and do hand washing to prevent the spread of the microorganisms. So now, put the equipment to the tray ahead of time will prevent the contamination, such as first, set or tray the catheter, which include the sterile gloves or the clean gloves, the urinary bag, and the catheter. And of course, the 10cc syringe, the plaster, and of course, we have the sterile water, the lubricant, the draw sheet, of course, and the forceps. So, will save us time and energy. So, now, put the patients of ease and explain the procedure to the clients and, of course, how she can participate during the procedure. Ensure the client's comfort and privacy by screening or closing the rooms and position the patients in a dorsal position with the knees flexed to have a good visualization of the meatus is that essential for the introduction of the catheter. And the gravity will aid the flow of the urine when the bladder is higher than the ends of the catheter. Hello ma'am, good day. My name is Casey Latombo, your student nurse from Double Doctors College. And may I see your wristband, ma'am? Please state your complete name. Okay, and when is your birthday? And what do you want me to call you? Okay, ma'am, just. So, the procedure that I will be doing is that I am going to perform the procedure of the urinary catheterization. So this order is based on the physician's order. So this will help you to relieve your acute urinary detention. So, and of course, I will be touching some parts of your body. So is that okay with you? Okay, so as you can see, I closed the curtain so that there will be no other people who can see us or disturb us, and of course to provide your privacy. Okay, so do you have any clarification or concerns? Okay, so I'm going to start the procedure now. So now, let's drape the patients, exposing only the area used. For the reason that is embarrassment and chillness, we can cause the patients to become tense. So the tension can interfere with easy introduction of the catheter and direct light visualization of genital use. So now let's go into drape the patients. So the second step is open the tray and arrange the equipment for the convenience and accordingly to avoid contamination of the sterile items. This is done for us to increase the speed of the performance. Now, use the sterile forceps. Cleanse the area using the cotton ball with betadine. This is done because the thorough cleansing of the meatus in the area surrounding it reduces the possible introduction of the microorganisms into the bladder. And open the set and put the sterile gloves to prevent the spread of our self and to our clients. And of course, put the eye sheet. So now, excuse me. So now, after cleaning the genital area, I am going to change my gloves because my gloves is already contaminated. So now, let's lubricate the catheter for about 1.5 inches, being careful not to plug the eye of the catheter. The purpose of the lubricant is to reduce the friction. So now pick up the catheter at least 3 inches from the tip of the thumb. Place the thumb and one finger of the left or right hand between the labia minora, then separate the pull up gently. Because separating the area immediately surrounding the meatus help make it visible. So now, insert the catheter into the meatus 2 to 3 inches or until urine begin to flow. So, female urethra is approximately 1.5 or 2.5 inches. So then, if a specimen is to be collected, pinch the catheter with the thumb and the finger while placing the specimen container in the position. Because urine will flow out of the catheter if lumen is not occulated. Now, rest the hand in the pubis area while holding the catheter and place to prevent pulling and pushing of the catheter. So, withdrawing the catheter and pushing it back into the urethra increase the possibility of the contamination to the urethra. Then afterwards, connect the catheter of the urine bag. So, let's assume this is a urine bag. So now, let's inflate the balloon 10 to 15 cc of the sterile water using the 15 to 20 syringe. So now let's do the aftercare. So of course, afterwards we need to place the patients comfortably and clean the equipment thoroughly immediately after use. Ensure secretion lubricants to the other substances are removed more easily when they are not coagulated. So for the documentation of the urinary catheterization, always include the date and time of the procedure and type and size of the catheter used. I use a two-way Foley catheter, latex silicone coated. Its size is 16 French. Also record the amount of fluid used to inflate the balloon. I use 10 cc sterile water and also document the character and amount of the urine, the reaction and response of the patient, and also include other significant observation.